Hi class, this is Dr. Heather Austin-Riblard, and this lecture video is going to be over one of the full threshold diagnoses for eating disorders, which is anorexia nervosa. In this lecture video, you're going to learn about some of the myths for eating disorders, the data that's presently available for anorexia nervosa, and the diagnostic criteria, symptoms, and health risks that are associated with anorexia. First, before we start about anorexia nervosa, I want to talk about some common myths that are present for eating disorders in general. The first myth that I want to discuss is that eating disorders isn't a serious illness, and this is actually quite the contrary. It is very serious and can cause severe physical, emotional, and mental impacts to a person. As we will learn later on, anorexia is actually has one of the highest mortality rates of any mental health illness. The next myth that I want to discuss is how some people perceive eating disorders as just being about food. While food does play a huge important component to eating disorders, there are other factors including a fear of weight gain or having a certain shape. Another myth is that eating disorders is just a woman's illness. While research shows that it does affect more females than men, we do know that it impacts boys and men and can just present differently. The last myth that I wanted to discuss is that the myth that only very thin people can struggle with an eating disorder, and it's pretty obvious to be able to look at someone and tell that they have an eating disorder. Again, this is not true, as people can present with a normal weight and still be very ill in their eating disorder. Now let's look specifically at some of the statistics that we know about anorexia nervosa. Approximately 90 to 95% of those with anorexia are girls and women. The lifetime prevalence of anorexia is 0.6%. This is 3 times higher for women, which is 0.9, than men, which is 0.3%. 1 in 200 women will be diagnosed with anorexia nervosa. Between 18 to 20% of individuals suffering with anorexia will die within 20 years. The probabilities of these deaths increase depending on the length of their condition. As I mentioned before, anorexia does have one of the highest death rates of any mental health condition. In fact, for women, the mortality rate is 12 times higher than the death rates of all causes of death for women between the ages of 18 and 24. And lastly, anorexia is the third most common illness in adolescents. Here are some of the common symptoms associated with individuals who struggle with anorexia. There's an inadequate food intake leading to weight that is clearly too low. They have an intense fear of weight gain, an obsession with weight, or persistent behaviors to prevent gaining weight. They often overly relate their self-esteem to their body image. They usually struggle with an inability to appreciate the severity of their situation. There's a binge eating and purging type, which involves binge eating and purging cycles, and there's a restricting type, which does not involve binge eating and purging. As I mentioned, anorexia is located in the DSM-5 as one of the full threshold diagnoses. In order to be diagnosed with anorexia, a person must meet all 3 requirements, including restriction, intense fear, and disturbance. Restriction is a restriction of energy intake relative to their requirements, which leads to a significantly low body weight that is in context with their age, sex, developmental trajectory, and physical health. They have to struggle with an intense fear of gaining weight or becoming fat, or persistent behaviors that interfere with weight gain, even if they have significantly low weight. The third criteria is that they have to struggle with a disturbance in the way one's body weight or shape is experienced, undue influence of body shape and weight on their self-evaluation, or a persistent lack of recognition of the seriousness of their current low body weight. As I mentioned earlier, there are 2 subtypes for anorexia nervosa. The restricting type is that over the last 3 months, the individual must not have engaged in episodes of binging and purging. Their weight loss should only be accomplished through dieting, fasting, or excessive exercise. They can be categorized in the binge eating and purging type of anorexia if over the last 3 months they've had recurrent episodes of binging and purging, i.e., self induced vomiting or misuse of laxatives. Again, this does not qualify them for bulimia nervosa because they've met the criteria for anorexia nervosa and they just participate in binge eating and purging cycles, but still have a severe restriction on their food intake. You may put in the diagnosis a specify of partial remission or full remission. These can occur when a person who has struggled with anorexia nervosa makes some progress in their recovery. In partial remission, they have previously met the criterion for anorexia, but criterion A has not been met for a certain period of time. However, they still meet the criteria B and C of intense fear of weight gain or disturbance of self-perception. They become full remission after they've already met the full criteria for anorexia nervosa. However, they no longer meet A, B, or C criterion for a certain period of time. When you diagnose an individual with anorexia nervosa, you also have to specify a current severity level. When it comes to anorexia, the minimum level of severity is based on an adult's current body mass index, or BMI. A BMI is a person's weight in relation to their height. And for children and adolescents, the BMI is a percentile. The ranges are derived from the World Health Organization categories for thinness in adults. The level of severity may be increased to reflect certain clinical symptoms, degree of functional disability, and the need for supervision. You would diagnose somebody with mild anorexia if their BMI is at 17 kilograms, moderate if their BMI is at 16 to 17, severe if their BMI is at 15 to 16, and extreme anorexia nervosa if their BMI is below 15 kilograms. Here are some signs that somebody might be struggling with anorexia nervosa. They have a dramatic weight loss. There's a preoccupation with weight, food, calories, and fat grams or dieting. They may refuse to eat certain foods, even progressing to the restriction against whole categories of food, like no carbs. They have frequent comments about feeling fat or overweight despite their weight loss. And they have severe anxiety for gaining weight or being fat. They may dress in layers as a way to hide their weight loss or because they are experiencing cold from lack of fat. They often deny hunger. They develop food rituals like eating foods in a certain order, excessive chewing, or rearranging food on their plate. They may have come up with consistent excuses to avoid meal times or situations that involve food. They often have an excessive or rigid exercise regimen and withdraw from usual friends and activities. And lastly, there may be a loss of period, especially in those that are cis female. There are several risks to one's health when struggling with anorexia. Let's take a look at some of those risks. Anorexia can impact the cardiovascular system. This can include heart problems like mitral vascular collapse, abnormal heart rhythms, or heart failure. They often struggle with problems in their gastrointestinal system like constipation, bloating, and nausea. Another severe symptom is their renal and electrolyte problems. Dehydration and electrolyte imbalance can cause low potassium, sodium, and chloride, which can lead to strokes. Their endocrine system becomes problematic, which can lead to kidney disease. They often struggle with metabolic problems. Due to their lack of nutrition, individuals can suffer from bone loss or osteoporosis. This can increase their risk for bone fractures and can cause severe muscle loss. They may struggle with dermatological problems like thinning of nails or hair loss, and their hormones may be imbalanced in their reproductive system. In cis females, this can suffer from anorexia or a loss of period or even infertility issues. And men may struggle with testosterone levels decreasing. All these complications can be very serious and even cause death. In fact, anorexia nervosa has the highest death rate of any mental illness. second being opiate overdoses. While anorexia nervosa is more common among females, it's showing up more and more in other populations. For example, anorexia is showing up more in men. In fact, the statistics may be higher than we even think because men are less likely to seek help for anorexia. Anorexia in males is more likely to get overlooked by doctors and therapists. Men who struggle with anorexia tend to come from families where there's a single parent home or where they have mothers that are very controlling and protective. There tends to be greater control, conflict, and achievement orientation in those families. And they might have a father that pressures them to excel in sports or have a specific muscular physique. Men with eating disorders have a history of being overweight, but also having been teased for it. Athletes in sports where aesthetics are part of the scoring system are at a greater risk for anorexia nervosa, like running, diving, gymnastics, wrestling. Gay men are twice as likely to have anorexia as heterosexual men. And there's a greater risk factor for men developing anorexia who have higher pressure jobs. Women from all ethnic and racial backgrounds can have anorexia. One part of the research that we've found is that acculturation is often linked with anorexia nervosa, meaning that the more acculturated they are to westernized society or white culture, the more likely they are to struggle with anorexic behaviors. Although some cultures do value thinness and others do not, the countries that value thinness have an increased rate of anorexia nervosa. Another problem that we find in the ethnic differences is that doctors may be overlooking minorities with anorexia nervosa. This is the end of this anorexia nervosa lecture. You should have learned about the criteria for diagnosing anorexia, the warning signs, and different health risks for struggling with anorexia nervosa. We'll continue to learn about the different ways we can treat individuals with anorexia and other eating disorders.